Tennessee Death Row Dogs, your local dog rescue nonprofit. Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome back to a very special series about mummy makeovers, proudly brought to you by the Plastic Surgery Centre of Nashville. We're here with Dr. Haws and Dr. Gingrass, and we're delighted to talk about this incredibly important subject. Welcome, ladies.
Thank you.
Glad to be here.
Absolutely. Now, we've talked about a few other areas. We're going to touch on the stomach area this time. Let's talk about some procedures and how it can help mums get that tummy back to where they'd like for it to be.
I think we touched on earlier, oftentimes women who've had a baby really hope that they can come to see us and that we can do liposuction to tighten up that abdominal skin and get their tummy back to where it was before. Unfortunately, because of the process that occurs with pregnancy that stretches the skin and stretches the muscle, it's not that you very, very seldom does a woman build up extra fat there after having a baby. More often, it's the skin is stretched. You develop stretch marks and the muscle stretched.
Right.
So it's a tummy tuck.
And so what is a tummy tuck?
Well, there are more than one type of tummy tuck, actually. It's sort of a continuum. There's a mini tummy tuck. There's sort of just a simple skin excision. And then there's a full tummy tuck with or without tightening of the muscle. So I think both of us kind of generally categorize it as a full tummy tuck, which is going to be a scar around your belly button and a scar basically from hip to hip. That's going to involve removal of all the skin that's between the belly button and sort of the top of the pubic hair, or a C-section scar if you have one. And then it's going to be tightening the muscle. Whereas a mini tummy tuck can be anything from just tightening that lower skin and leaving the belly button alone and leaving the upper abdominal skin alone. And it also might mean taking the same amount of skin but not tightening the muscle.
Or it might mean occasionally we get women who just need the muscle tightened. Their skin's fine. It's just the muscle, those six-pack muscles that start out like this, push apart with the pregnant stomach, and then they never quite go back. And so we can tighten those muscles back together. So and that's the thing. People say, well, am I mini? Am I full? Well, as Dr. Gingrass said, it's a continuum, and we really need to check each woman's belly to see what the problems are and what we need to fix.
I think the point is that we can individualize it to the needs of the patient. So it's, and somebody might come in thinking they need a tummy tuck, and really all they need is a little liposuction. Uncommon, but it does happen, and we're totally open to discuss surgical options with each individual patient, and oftentimes we can give her the option, and she can decide what best fits her lifestyle, how much downtime she's got, how much time she can get off work, because those are really important things with the tummy tuck. A full tummy tuck can require, a good 2 weeks off work, and you often have to plan ahead for something like that. You've got to get people to take care of your kids. You've got to get 2 weeks of work off together. Those are all things that require some logistic acrobatics.
But our job is to look at the patient and to let them know, find out what their desires are, and then find out how we can achieve that for them. And if we can't get them where they want to go, be able to communicate with them about what we can do, and what we can do with the downtime that they have, what they can budget themselves for as far as time away from their work, time away from their kids. Oftentimes, it seems to me, most of my patients who have had a C-section, a recovery from a full tummy tuck is very similar to the recovery from the C-section, only you don't bring home a newborn. That's the only upside.
Sure. And I imagine, there's so many, especially now with health being such a focus, mums when they're pregnant, mums after, hitting the treadmills, doing as much as they can. And I imagine that's an incredibly stubborn and frustrating area. I guess you can cover up the vaginal area and maybe, cover up the top with a bikini top, but having that loose skin must be just, very traumatic, I guess, for a mum who's just trying so hard to get rid of that area.
We always people say, well, I'm never going to wear a bikini again, and I like to say, girlfriend, we can get you back in a bikini. And that's a great feeling to feel like you've got your body back. And because it can be really frustrating after pregnancy to work really hard on the treadmill and have your trainer even be telling you, well, if you just do more sit-ups, if you just work on that core more. And really, oftentimes people are getting misinformation, and they need a tummy tuck.
Because if you've got twice as much skin from your ribs to your pubic bone as you had before, no amount of sit-ups or treadmill work is going to get rid of the extra skin. That's why you need us.
Sure. And I know we talked a little bit off camera about this, but I'd love to touch on it. It's really interesting. The difference in height of a female from one to the other can affect the tummy and the pregnancy. Is someone who's taller more susceptible to having these problems, or how does that work?
Well, there's a lot of factors that go into whether you're going to get stretch marks or whether your body's going to, how it's going to tolerate it. But if there's just simply more room for a baby to grow, most babies are pretty similar size. Uteruses are all about the same size. So if there's more room for a baby to grow in, theoretically, at least in a lot of cases, there's not quite as much damage to the skin if there's more room. It's a theory.
It's a theory. It's an interesting one, though. And we've absolutely loved having you guys in the studio again. Thank you so much, Dr. Haws, Dr. Gingrass. And this is a great series. As you guys know, hopefully you've tuned into the last few. If you haven't, you can definitely jump online and check them out. And we do thank the doctors for coming in. And we have a little bit more to go, so we hope that you'll join us next time. Thank you.